If a person was extremely sick back in December or January before they were checking for COVID-19, could it possibly have been it then? And if so, are they immune from it now?
So the question of that, it's hard to really say at this point. It could possibly, that would have been really early in the time when we had the first US cases. As far as them being immune to the disease, we're just not sure of that. Down the road, I think that we would be able to check for coronavirus antibodies. But at this point, that question is really unanswerable at this time.
I'm 66 and feel fine, but I have a 98-year-old mother who lives alone close to me. She's currently healthy. Is it still okay to visit her once a day if we follow hand washing precautions?
A loved one who is older is really at high risk for coronavirus. And unless it's absolutely essential to visit your loved one, I would recommend sort of staying away, especially to follow and support our state public health officials and what their recommendations are, because your loved one at that age can be at very high risk for catching the virus and becoming very ill from it.
What if you had symptoms, but you're over them now? Can you still get tested? And how do you know when you can leave your house?
You know, if you did have symptoms, it very well could have been coronavirus. And if the symptoms are much better, to test at this point is probably not going to offer much. What I would recommend is staying home, give yourself the 14 days. And at that point, after the 14 days, it would be safe to say that you're allowed to leave the house.